Timothy Jones.
Yes,
hello.
Hi.
Dr. Gallagher, pleased to meet you.
Please not.
Right. So thank you for coming. We've had a letter from your doctor asking us to see you about headaches.
Oh, yes.
Right. Okay, so can I, first of all, just get you to tell me what these headaches have been like when they started and what's been troubling you?
Well, it started, must have been about 4 months ago now.
Okay.
They really are quite severe and last all day, really. And it's my entire head. Really, really hurts.
Okay. So about 4 months.
Hmm.
Have they been coming on gradually worse over that time, or did they suddenly start and have been there all along? Or?
They've been building up a little bit,
Okay.
if you know what I mean,
Yeah.
a couple of weeks beforehand. But for the last, say, 4 months, they're really bad. But 3 months now, I've been taking, painkillers for it. It's getting really bad.
Right, okay. Do the painkillers work, or...?
Not really, no.
Okay, I'll come back to that. So the headache's all over.
Yeah.
Are there any other features you've had with the headache? So, for example, do you get any warning before they come on?
No, they usually start when I get up of a morning.
Are they there when you wake up? Or?
Yes, they are.
Okay.
And I feel really sick, really nauseous.
Okay. And okay. Has the nausea been a recent thing, or has that been all along as well?
That's been all the way along, yeah.
Any visual symptoms? Notice any change in your eyesight?
No, none at all.
And with the nausea, have you actually been sick at all, or is it just a feeling of nausea?
It's just a real feeling I'm going to be sick. I've never actually been sick yet.
Okay. And so you're taking some regular painkillers. What are you taking?
I take ibuprofen
Yep.
and paracetamol.
How many times a day do you take the ibuprofen?
I take the maximum I can, which is 4 times a day, according to the box.
And the paracetamol, same maximum?
Maximum, yeah.
You don't exceed the maximum dose?
No.
Okay. Okay, and have you had headaches like this before in the past?
When I was younger, I was about 20 years old, I started to get headaches then, but they were different.
Okay, did you ever see anyone about those or have a diagnosis?
I saw a neurologist.
Okay.
The GP referred me to a neurologist, and they just put me down to stress, really.
And did you need any medication for them, or did they?
No
Okay.
medication.
But you saw a neurologist about
Yes.
that. Okay. And these are new. These headaches are different.
They are, yeah. The original headaches when I was younger, they were just at the front,
Okay.
and I didn't feel sick with those. But these,
Any other symptoms around these headaches that you've noticed? So, for example, have you been losing any weight, or
no,
any change in your bowel habit?
none at all like that. No.
Any cough?
No.
Okay. Tell me about your health otherwise. What other medical problems do you have and you suffered with in the past?
Let me see. I had asthma as a child,
Mm-hmm.
but I don't take anything now for it.
Yeah.
I had my spleen taken out. That was 10 years ago now, after a car crash.
Was that okay?
Yeah, just as a passenger, but not very pleasant. I suppose you know I'm actually HIV positive.
Okay. How long have you been HIV positive for?
That's 7 years now since I was diagnosed.
How were you diagnosed? Was it just on a screening test, or did you?
I went to a sexual health clinic just to
Right.
be screened. I had a partner
Okay.
at the time.
Can I ask you a bit about your HIV actually? So,
Yeah.
so you've been diagnosed about 7 years.
Yes.
Are you on treatment at the moment, or?
I'm on the Atripla, which is the
Oh, yeah,
chemotherapy
okay.
combination one. Yeah.
A triplet.
Yes.
Is that just once a day?
It's one tablet once a day. Yeah.
Okay. Are you? Do you know what your CD4 count and viral load are?
I had it done. That must have been about 3 or 4 months ago. It was 690, which they tell me was.
Oh, that's quite
okay
good.
for
Yeah.
CD4, The viral load was. There was nothing to it really.
Okay. Did it undetectable?
Undetectable. That was the word.
Okay.
Yeah. I couldn't think of the word they used. Yeah.
Okay. Well, that's good news. Have you had any bad infections in the past as a result of the HIV?
No, I've been very lucky that way. I've never had anything like that. I've never picked up anything, and I'm very acute, particularly when I take the drugs religiously. And I've always been very good, which is what worried me about this. I must admit.
Okay. Yeah. Okay. I mean, Well, I do worry a bit about headaches and HIV because
Well,
obviously you're aware there's all sorts of
they
potential.
tell you about these opportunistic infections
Yeah.
and getting weird infections and cancer
Yeah.
and stuff. So, yeah, obviously I've got to be worried about it. I must admit.
Yeah, okay.
It wasn't bad enough to mention it last time when we went to get my blood test done, but
So who looks
this is
after
what
your
was.
HIVs?
It's a Dr. Gillett over at Hope Hospital.
Okay. Okay. Just given that, I'll just ask you a few more questions. So have you been having any fevers at all recently?
No, nothing like that. No.
You've been, and you've not had any other unusual symptoms? Change in your hearing, change in your taste, weakness of any of your limbs?
Nothing like that. No, it's just been this banging headache.
Okay. You said you'd taken the painkillers and the A-triplet. Are you on any other medication?
Nothing at all. No.
No other medications. Any allergies?
Penicillin brings you up in a rash.
Okay. No other drug allergies that you've been given?
No,
prescribed
nothing
drugs?
like
What do you do for a living?
that. I'm a scriptwriter for the BBC.
Okay.
I do a lot of work from home.
Right.
And that's getting a bit stressful at the moment, I must admit. I just keep forgetting. I'm putting it down to this headache. I'm getting very forgetful, and I have like a kind of block at the moment.
Right,
Like
okay.
doing things. It's really annoying. Just can't seem to get over it.
How long have you had that for?
That's been coming on about, say, 4 or 5 months now. I just getting more and more fuzzy.
So it's
and
been
whatnot.
tied in with the headaches, you think?
It has, yeah. I would say yes. It has been.
Okay.
It's just getting me down. I mean, you know, it's your living. It's just what I'm doing. I just can't seem to like get 2 words strung together now.
Do you smoke?
No.
Do you drink alcohol?
I have a couple of wines of a night. Nothing terrible.
Do you know the recommended units they recommend a week?
Oh yes, I do. I drink.
Do you
I
think
drink under about 20
Okay.
units a week.
And who do you live with? Do you have a partner at the moment, or?
Not at the moment. My partner passed away about 4 years ago. I live on my own. Yeah.
Right. Okay.
The 1-bed flat is not the nicest place in the world.
Right. Okay. Right. Okay. I think I've got quite a bit of information about what's been going on.
Mm-hmm.
Your background of a headache that's been coming over, sort of getting worse for about 4 months, with some forgetfulness and being sick, feeling a bit nauseous in the morning.
In the mornings, yeah. I must admit, when I leave home or like go with friends or something like that for a weekend, it does ease off quite a lot. I must admit, it really does. It's just when I'm at home, I suppose it's stress or something. I don't know, or something going on or something. I've got no idea.
As in, it eases off when you go away from home?
Yeah, it does.
Are the headaches worse when you're inside then, have you noticed?
They seem to get worse. The more I'm inside, the more I try and work. You know, more I'm sitting there trying to work. Trying to work all
gas central heating, do you?
Yeah, I'm always having to have a go at the landlord about that. It's a right crappy system, I must admit. It doesn't work properly.
You not had a carbon monoxide detection kit fitted in there, have you? Or ever had that tested?
No.
Okay.
Not at all, no.
Okay. Right. I think to sort of pull things together, I need to take you next door and examine you in a minute.
Yeah.
But we see a lot of people who have headaches.
Mm.
For the most part, examining them doesn't always help, actually. And really, it's a matter of doing some further tests.
Okay.
Given your history of the HIV,
Right.
and also your description of the headaches being worse in the morning, I think we ought to get a brain scan done, and I'll go on and get that done within the next 10 days.
I'm a bit worried about that. You hear of these cancer swarms, really weird cancers, and I've never had anything like this before, not really.
It may be we need to do additional tests as well, and I think you're also aware that given your HIV, we need to be particularly cautious about infections, things like TB, for example.
Right.
You can get TB even when your CD4 count is actually quite good. And I think I'm going to need to liaise with the infectious disease doctor, your team at Hope.
Okay.
I think probably we should do this in conjunction with them.
Right. Okay. I mean, they know I'd tell you about this.
Yeah. So I will liaise with them, and I think probably once we've got the scan,
Mm-hmm.
we'll need to do a whole battery potentially of other tests.
Right.
There's probably is worth. You just mentioned your headaches are worse when you're at home and you've got gas heating.
Yeah.
Carbon monoxide, which if you've got a gas boiler that doesn't burn properly, sometimes you notice the flame is red or orange instead of blue.
It is orange actually. Now you say that, it is orange because I keep on
Really?
about to landlord to
Okay.
say, look, this is really wrong, and it always breaks down. It's never working properly, and he's just.
It's probably a bit of a long shot. You can buy a carbon monoxide detector kit from any DIY store.
Right.
And you can take it home,
Mm.
put it in the house near where the gas supply is,
Right.
and see if it lights up or not. They're normally fairly self-explanatory on the box. That could explain all of your symptoms. I don't
Right.
think I think if you do that and it comes up positive, you need to phone me straight away because it maybe will save you a lot of other tests. But
Yeah.
I think that's it's a bit of a long shot that. Very rarely see carbon monoxide poisoning like this. But if you are exposed to carbon monoxide, low doses over long periods, it can cause headaches,
Right.
and it can make you feel quite sick, and it makes you feel a bit forgetful sometimes as well.
But I just cannot put two words together, and it's becoming a real problem. I mean, the more that happens, the more stressed I get. If you know what I mean,
Okay.
it's just working on itself now. But do you think anything might be going on inside my head at the moment?
I think it's difficult to know. I think given what you've told me, I think your doctor's been absolutely right in referring you up, and I think we need to investigate it further. And I think leaving the possibility of anything like carbon monoxide aside, I think we need to, unless that comes up positive, we need to go looking for another cause.
So if I was to go and buy one of these kits, as you say now,
Yeah.
just to test it, if that come up, then I'd contact you.
Yeah, I think. You could even. If you could get hold of one tomorrow, you could even give my secretary a ring tomorrow. And so if you phone up the hospital and just ask to speak to my secretary,
Right.
and just let her know what that shows, I'll be quite keen to know.
I'll do that straight away. Trust me.
Yeah, okay.
Anything to get rid of this. It's getting me down.
But I think we ought to make a plan to be investigating you. If that doesn't show anything, we will get on with the
There's
investigation.
definitely a plan to go forward and see what this is. If it's not that, okay.
And I think that plan is to do the CT. I think it's going to need some additional blood tests to update all your HIV blood tests and all your screening tests for the infections that can potentially cause trouble.
Okay.
And that means I'm going to need to liaise with the infectious diseases team.
Yes.
The other thing that you did just mention is you're taking regular painkillers.
Yes.
One other thing that has crossed my mind is some people, when they take regular painkillers every day, the painkillers in their own right can sometimes cause a headache. It's what's called an analgesic headache, where and
Didn't know that.
yeah, it's perhaps more common with the ibuprofen than the paracetamol. But I think I'm going to arrange to see you again in 2 weeks,
Okay.
whatever. By which time you'll have had the scan, we'll have got some more blood tests done, and I'll be able to come back to you with some results.
Okay.
But it would be useful in that time if you could try and stop taking painkillers, because you may find, and some people find when they have chronic headache, if they stop the painkillers, the headaches actually improve if you've been taking them regularly for a long time. So obviously if you go 48 hours and it gets too bad, you just have to go back on that.
Well, it doesn't seem to make much difference, to be honest with you. You take them because you feel you should be doing something about it.
In which case, I think it'd be useful if you could stop taking the painkillers until I see you again.
Okay.
And then I'll see you in a couple of weeks. And
Do you need me to contact my people at Hope to let them know you're going to...
I'll get in touch with those if that's okay.
Okay.
If you're happy for me to.
Yeah, no, I'm more than happy to, yeah. I'm not, closed about this. I'm more than open about it. But I'll get one of those carbon monoxide detectors, and
Okay.
if it does work, that'd save me a lot of hassle, I must admit. It'll be a weight off my mind, literally, to have that done. No, that would be good.
Are there any other questions you wanted to ask me today, or anything else you wanted to bring up today?
No, obviously I'm just worried that with the HIV, obviously I'm worried about opportunistic things happening to me, and
Yeah.
I've never had anything before like this. I've been quite lucky, I suppose, touch wood. This has happened, but I just worry about it might be something to do with the brain or a tumour or infection.
Yeah. I think it's too early for me to say whether to say. Let's go on with the scan.
Okay.
So you'll get a phone call from the scanning department in the next few days. It'll be about 10 days before they do the scan.
Right, okay. And if the detector does say there is carbon monoxide, do you want me to cancel that appointment or keep it?
If it does,
Yeah.
give me a ring and I will see you again. I think if we can sort that out and your headaches go away within a couple of weeks, we'll probably cancel everything. But we'll wait and see.
It would be good. It would
Okay.
be good. Well, thank you. I really appreciate it.
Okay.
Thanks.
All right.
Thank you very much. Thank
All
you.
the best. So this is the discussion related to Mr. Jones, who was referred to the General Medical Clinic with a headache. This was a sort of potentially nightmare case in the exam. I think you'd be unlikely to get both headache and HIV thrown in together in the exam. But it's quite useful to discuss the individual points and break them down. Firstly, headache, and this is a common thing to be presented with in the MRCP exam. It's slightly different to what you would see on the medical wards, because people in the exam tend to be chronic headache rather than the sort of the possible subarachnoid hemorrhage headache of a medical admissions unit. And so you must have an awareness of the differential diagnosis. Bear in mind, most people with chronic headache don't have underlying brain tumours, but things like migraine, tension headache, cluster headaches are far more important to be able to sort of pick out the subtleties in the history. Never forget, though, that people, when they do have a headache, particularly those headaches firstly in the morning associated with nausea, and perhaps if it's exacerbated by coughing or sneezing, you worry about the possibility of raised intracranial pressure, possibly a mass lesion. Carbon monoxide was thrown in there because it's an unusual diagnosis, but it's one the government's released sort of white papers on almost every year for some years because it's hugely underdiagnosed, and is one of the important differentials of a morning headache. Often without the other features of raised ICP, it doesn't get worse with coughing. The other side of this case was the presentation of someone who coincidentally has HIV, and in this case it was probably unrelated to his diagnosis, although maybe. HIV used to be a specialty which was the remit of the infectious diseases doctor or the sexual health doctor, whereas now pretty much every specialty is finding that we're managing people with HIV as a chronic disease, while they also have other medical problems like headache or inflammatory arthritis or inflammatory bowel disease. So it's important to have an awareness of HIV. When you ask someone about HIV, it's important to ask them how long they've had the disease, because duration of infection is an important risk factor for complications, for example malignancies and also cardiovascular disease. Ask them whether they've ever had a history of opportunistic infection. A history of TB, for example, would be very important. Ask about what their current treatment is. You're not expected to know all the treatments, but bear in mind that many of the drug treatments for HIV interact with commonly prescribed medications, for example statins or proton pump inhibitors. So you must be very aware of what they're taking and then reference whatever you're going to prescribe with what they're already on. And then it's sensible to ask them if they know their current viral load and CD4 count. Much like if you saw a diabetic patient, you'd say, what's your latest HbA1c? And a lot of people with HIV will be very informed and to be able to tell you exactly what their numbers are. And that gives you a guide. If their CD4 count is healthy or low, it gives you a guide as to whether they might be at risk of opportunistic infection. And hopefully their viral load, you'll hear, will be undetectable if they're on a good combination. If it's not, it may reflect their HIV control is not as good.